This conference will now be recorded.
Hello, my name is Charmaine Wages. I'm a licensed health and life insurance broker here in Arizona and a couple of other states, and I specialize in assisting those folks who are or about to be Medicare eligible. I've been in the Medicare insurance field since 2011, and before that, I was a financial advisor. Today, I want to give you an overview of the Medicare basics, and I think we just better call it Medicare 101. So after you've watched the presentation, if you have questions that are specific to your situation, feel free to give me a call. There is no charge or obligation to talk to me and get your questions answered. So let's go ahead and start with the slides. Medicare Explained. My contact number is on here, 480-409-1717. I also have a cell phone, which is usually the preferred way to reach me. That number is 415-999-0903. That's a San Francisco number, but I've been living in Arizona since 2005. So this is what your Medicare card will look like. It has a gobbledygook number that has replaced the Social Security number, which used to be on the card. So that number is only good for the insurance companies and the hospital and the doctor. So if your card gets lost or stolen, you don't have the identity theft risk that you once had. There are 4 parts to Medicare, and I stress the word part because later we're going to talk about the plans. So the 4 parts to Medicare are Medicare Part A, B, C, and D. So Medicare Part A is the hospital. We all get Medicare Part A for having lived and worked in the United States for at least 40 quarters or married to somebody who has. And that covers the facility charge for the hospital and the skilled nursing facility. Now, these plans do not have a monthly premium. There's 0 premium, but there is a deductible. So if you go into the hospital and you only have your red, white, and blue card and you do not have insurance to go along with it, then you will pay your first night in the hospital $1,408. Now, that is not an annual deductible like we usually know deductibles to be. It's a per benefit period, and a benefit period is 60 days. So if you go into the hospital now and have your gallbladder removed and you're on original Medicare without a plan, you will pay $1,408. 61 days from now, let's say you go into the hospital with pneumonia, you'll pay another $1,408. And 61 days later, let's say you go in with a fractured hip, another $1,408. So you can pay over $7,000 in deductibles on Medicare Part A. Now, Medicare Part B is something we all want, and we don't mind paying for that because Medicare Part B covers everything outside of the hospital. So that's our primary care doctor, our specialists, the surgeons, urgent care, the emergency room, lab tests, x-rays, MRIs, and ambulance services. So we don't mind paying for that, and for most of us, that monthly premium is $144.60. Now, if your income from 2 years ago was higher than $174,000 for a married couple or $87,000 for an individual, then you will be asked to pay more for your Medicare Part B. And it's called the Income-Related Medicare Adjustment Amount. And based on your income from 2018, because we're in the year 2020, they look back 2 years at your adjusted gross income. And believe me, there's no hiding because they have a direct line into IRS. So based on what your income was in 2018, they can adjust your Part B premium accordingly. Now, in some cases, you can appeal that. And if you want to talk about that, feel free to reach out to me. Now, Medicare Part B also has a deductible, but that deductible is a much more reasonable $198, and that is an annual deductible. So if you're using original Medicare, just your red, white, and blue card, once you pay the $198, then you are responsible for 20% of all of your Medicare approved charges. Now, I stress the word approved, okay? So we used to know the 80-20 plans before Obamacare, where our insurance picked up 80% and we were responsible for 20%. So we always had a cap on those. In this case, with Medicare, there is no ceiling. So you are responsible for 20% of all the approved charges, and there is no ceiling. So let's say you had an organ transplant that might have cost, I don't know, $300,000. You would be responsible for $60,000. That's 20%. So it could be a pretty significant hit to your finances to be responsible for that. So you actually have two risks with the original Medicare. You have the Part A hospital deductible, $1,408 up to 5 times a year, or $7,000. And you have the Part B coinsurance of 20% without a ceiling. And those are the reasons you want to choose an insurance plan to go along with your Medicare to protect you from these high costs. Now, as far as signing up for Medicare Part B, if you're already on Social Security, you don't need to do anything. It'll automatically come in the mail, your Part A and Part B on your card. You're automatically enrolled. And they will automatically take your $144.60 out of your Social Security paycheck. So you don't have any say-so in that either. If you're turning 65 and you're not on Social Security, then you can sign up online, and it's a very easy process. It takes 10 minutes. However, they will verify you. So they're going to ask you some verification questions to make sure you are who you are. And if you mess up on those questions, then you will be forced to go to the Social Security office. So the questions are things like, which of these phone numbers did you ever have in the past? And they'll give you 4 phone numbers. Or which of these lenders did you use at some point in the past? And so and of course, one of the answers is none, because if it wasn't. But if you make a mistake, then you will be forced to go into the Social Security office to sign up for Medicare Part B. Now, if you're over 65 and you're on a group health insurance plan and you want to go on Medicare because you're retiring, then it's a little bit more complicated, but not much. You will go online and print off the Part B application, and the Part B application is incredibly easy. Name, address, Social Security number, and date of birth. Then you also need a form from your employer showing that you had creditable coverage. And they do that so that you don't get charged a late enrollment penalty for waiting to sign up for Part B. So as long as you can prove that you had coverage through your employer that was as good or better than Medicare, then they're not going to charge you the penalty. And if you're turning 65 and still employed, and you're still covered under a group health plan with more than 20 employees, you are not obligated to choose Part B. You can stay on your group plan until you retire. So understand, you are not obligated to go on Part B if you're still working. Now, once you sign up for Part B, you have basically 3 choices in how you want to manage your Medicare costs. So we'll start with just taking the Medicare card by itself. So if you choose to just keep the red, white, and blue card, don't go out and buy a plan and pay the $144.60 per month to be on Medicare, then this plan will give you the choice to go to any physician you wanted to go to, as long as they accept Medicare patients. You do not need a referral. It's basically an inexpensive plan because you're only paying $144.60 per month for most people. And you can go to any provider you want, and you can go to Mayo if you chose to. The downside to this, I've already described. You have those 2 big risks of the 5 times a year maximum hospital deductible of over $7,000, and also the Part A 20% coinsurance. So just be aware that, those are the 2 biggest risks from just holding on to the red, white, and blue Medicare card by itself. Now, you can take the Medicare card and add a Medicare supplement, also known as Medigap. These are private insurance plans. And what they do for you is they pick up that 20% Part B coinsurance, and they pick up the hospital Part A deductible so that you don't have to pay those. And they still allow you to go to any doctor you want to go to as long as they accept Medicare. You do not need a referral to see the doctor. The most popular plan has a $198 deductible. That's the Part B deductible. And then everything else is picked up 100%. If Medicare approves the procedure, it's picked up at 100%. This plan is also accepted at Mayo Clinic if that's important to you. And you can make a switch to these plans any time of the year. You don't have to wait until the special enrollment periods that they offer for Medicare. You can change any time during the year. Now, the negative side to a private Medicare supplement Medigap plan is that in addition to the $144.60 per month that you're paying for Part B Medicare, you still have to pay a premium for this plan. And the premium for this plan for a 65-year-old can run anywhere from $115 to $160, depending on the insurance company. And for the most popular plan, which is currently Plan G, there is a deductible, an annual deductible of $198. And then all of your costs past that are picked up at 100% if they are Medicare approved. Now, these plans also do not have the extra benefits that you see advertised on television for Medicare Advantage plans. So you're not going to get dental, vision, or hearing on these plans. Sometimes you will get a fitness benefit. If you switch plans during the year and you've decided that another plan is a little bit less expensive, you can switch whenever you want to, but after you first go on Medicare, you will be asked the health questions. It's called health underwriting. And if you, in the meantime, have developed a health condition, a cardiac condition, lung condition, cancer, or been in the hospital, then a private company can and will decline you. Then at that point, your choice is to stay on the plan you're on because they can't decline you or they can't drop you once you develop a health condition. They can't drop you except when you stop paying your premiums. So you would stay on that plan, or you could go on to Medicare Advantage. So let's talk about Medicare Advantage. Medicare Advantage was designed as an answer to the high cost going to Medicare. Before 2005, most people were either on original Medicare or original with a supplement, and they were going to the doctor pretty much for anything and everything. And doctors, worried about malpractice, were ordering tests and x-rays almost without restraint. And so it was draining the system, and Medicare was running out of money. And I have heard it said that somebody went in front of Congress and said, what is the government doing in the insurance business? And they kind of agreed. So they hired all the insurance companies that, well, not all, but most of the insurance companies that offer private insurance, like the Medigap and supplements. They said, okay, will you help Medicare administer these plans for Medicare? And so they agreed. They administer the plans. They get paid the $144.60 if you choose to go on Medicare Advantage. Whichever company you choose will get that $144.60 Medicare Part B premium in exchange for keeping you healthy and trying to keep you out of the hospital and managing your care. So under Medicare Advantage, there are two basic types. They're HMO and PPO. The HMO is a network plan. So that means that all of your doctors and all of your services have to be done within a certain network. And each insurance company has their own networks. So we usually start by looking at your doctors and saying, okay, can we get all these doctors in one network? And then we'll look at that insurance company's plan. So the other nice thing about these is that it is a zero monthly premium because these plans are being paid by the government, $144.60. So they're not charging you to be on the plan, they're charging you co-pays at the time of service rather than a monthly premium. Usually there is no deductible, and these plans will toss in benefits like dental, vision, and hearing. And they will frequently throw in the drug plan, where if you're on private insurance, you have to go out and buy the drug plan separately. They will toss these in as a benefit. Now, you will typically need to have referrals The negatives to these plans are the referrals. Also, you have to continue to pay your Part B premium, $144.60, so you can't participate in the plan. And you must use in-network providers. So let's say you happen to hear that the best cardiologist is in Los Angeles. Well, you can't go. Nothing will be covered. So you have to stay within your network here in Maricopa County, or the county you live in, Pinal, for example. If by chance you are in Los Angeles and you have a heart attack, then you will be covered for the heart attack. You will be seen at the hospital. You will go through the emergency room, and they will treat you for the heart attack. But then as soon as you're stabilized and ready for rehab, they will send you back to Maricopa County to continue your recovery. So you will be allowed to travel and have coverage outside of your network for emergency only. But for decisions of things that voluntary, you must use doctors that are in the network. These plans are not accepted at Mayo. So if that's a consideration for you, then you would want to go on to the private plans. Now, in response to the restrictive nature of the HMOs, many plans recently have come out with PPOs. And they are still network-based, but they allow you to go out of the network if you choose to. So, say you do have a heart condition and you really do want to see that specialist in Los Angeles. Well, on a PPO, you can do that. You can leave the network, you can go see him. The difference is that your copays are going to be higher. So the PPO allows you a little bit more freedom of choice. You do not need a referral. You can go out of the network, and they also offer the same, usually the same extra benefits like dental, vision, and hearing. Most often these plans have the drug plan built in, so you don't have to go out and buy it separately. And so it's a nice option. As far as negatives, it's pretty much the same negatives as the HMO in that you cannot use Mayo Clinic. And there are specific times that you can change plans. I'll show you those periods when you can make changes to your plan. And some of these plans may have a deductible. And on the PPO side, some of these plans may have a small monthly premium on top of it all. These are the plans that are available as private plans to people who are new to Medicare after January 1st, 2020. If you were on Medicare before, then you could still get what is known as Plan F. After January, if you're new to Medicare, you cannot get Plan F. The new popular plan is Plan G, and you can see it's missing one square that does not have coverage, and that is the Part B deductible. So as long as you pay the Part B deductible, currently $198, then everything else is covered at 100% as long as it was approved by Medicare. Now, there are some other plans that are a little bit less expensive, but as you see, they don't pick up quite as much in terms of coverage as the Plan G. Again, the Medicare Advantage plan is a bundled plan, so it includes the hospital, everything outside the hospital, and the drug plan all in one package, 0 monthly premium usually, and you just have one insurance card. And as I mentioned before, they'll throw in all these extra benefits like vision, dental, and hearing, and maybe even an over-the-counter catalog of, supplies that you would get at Walgreens or Walmart, mouthwash, vitamins, that sort of thing. None of these are covered under private insurance, Medicare supplement, because Medicare supplement plans only cover what Medicare covers, no more, no less. Medicare Part D is your prescription drug plan, and you don't get it by calling Medicare. You get it by virtue of enrolling in a Medicare Part D insurance plan. Now, these are technically voluntary plans, but if you don't sign up when you're first eligible at age 65 or when you retire, then you're going to be penalized when you do sign up for it. The insurance companies have recognized this, and they have dropped the premiums, the monthly premiums, down very low. You can get these plans for as little as $13 a month. Now, that's the premium to be on the plan and to participate in Medicare Part D, but you still have to pay for your drugs. And so you pay co-pays. They break all the drugs into 5 groups. They're known as tiers. Tier 1 and 2 are your generic drugs. Tier 3 and 4 are your brand name drugs, usually the drugs you see advertised on television. And Tier 5 are your specialty drugs, frequently oncology drugs. So your Tier 1 and 2 drugs are very low price, $0 to $5 per month. And your Tier 3, 4 can run anywhere from $47 on up to over $100 per month, depending on the plan. So you are not obligated to buy your drugs on this plan. You can go off plan, and that's why you hear some people are saving money by going to Mexico, or some people will save money because they'll use the GoodRx app when they go to the drugstore if the price of the drug is cheaper on the app or in Mexico than it is on your plan. So you still have to be an informed consumer. Medicare Part D also has the income-related Medicare adjustment amount that we refer to as IRMA. So depending on your income from 2018, you may be asked to pay a little bit more. Now, if you're on an Advantage plan, you're not paying anything for a plan premium to be on the plan, but you will have to pay this extra amount to the government for the adjustment to your income. And if I didn't mention it before, if you want to contest this, talk to me. There are some very limited times when you can appeal it, and they will not charge that higher amount. As a summary, we're going to look at what might be best for you. On the left-hand side is the original Medicare red, white, and blue card, and you go out and you buy a private plan known as Medigap or Medicare Supplement, the popular one being Plan G, and you go out and you buy a drug plan. Or you can go on Medicare Advantage, whether that's HMO or PPO, and you have everything tidied up in one package, one insurance card. It includes the drug plan. You have some limitations with that on the Medicare Advantage side. You do need some referrals. You cannot go to Mayo, but it's good quality care. So as far as those times that you can use to sign up, when you are new to Medicare and just signing up for Part B, you qualify for what is known as the IEP or initial election period. So you can sign up for Medicare anytime during the year. If you're turning 65 in June, then you can sign up for Medicare 3 months before your birthday, the month of your birthday, and 3 months after, and then select a plan. Now, if you're already on Medicare and you don't like your plan, then during the annual enrollment period from October 15 until December 7, you can make a change to your plan that will be effective on January 1st. They added something new recently called the open enrollment period, because let's say you did make a change to your plan in October to December, January comes around and you find out that your doctor left the network, or there was some other detail in this plan that you simply didn't like. And so you get a one-time do-over to make a switch to your Medicare Advantage plan. And I'm stressing Advantage plan. You cannot change your drug plan, you cannot change your supplement plan, but you get a one-time do-over to make a change to your Advantage plan. Now, during the year, there are times that some people will have other things that qualify them for a special election period. They're retiring, for example, in July, they might decide to retire from their group health insurance coverage and from the company they were working for. So that gives them a special election period to sign up anytime during the year. Or if you move, because Medicare Advantage is very geographic centric plans. They are based on the county you live. So if you move to a different county, you will have to change plans. If you move from the Phoenix area to Tucson, you will have to change your Medicare Advantage plan to a plan that's offered in Pima County. As far as how do I get paid, any insurance company that you select, whether it's for supplement or for Advantage, will pay me directly as the broker. And you will not pay any more for using me or any less by not using me. What you will get is an advocate, and I will step in and assist you and answer your questions, and if need be, step in with the insurance company and help you resolve any issues that you might have. So that's the end of the presentation today. Thank you very much for your time. If you have any questions, again, feel free to reach out to me. I'm happy to assist you, and have a wonderful day.